Hello everyone, my name is Jerry Prohl. Thank you for joining me for my presentation on HR 2581. We'll start with a quick overview. The aim of this presentation is to explain the details of HR 2581, Nurse Staffing Standards for Hospital Patient Safety and Quality Care Act of 2019. The issues that this bill hopes to correct are identified, and any current acts that may be affected if the bill is passed are elaborated on. Background information is provided to allow the audience to understand what caused the need for this bill. Arguments for and against the introduced legislation are provided with supporting literature. In conclusion, research conducted to present this information finds the bill to be overall well constructed, but it is recommended that legislators amend it to include the effects patient acuity and nursing experience have over appropriate nurse-to-patient ratios. Increased nurse-to-patient ratio has been proven to negatively impact the quality of care that patients receive at hospitals, as well as increasing the workload of the nursing staff. The Journal of Nursing Management recently published an article that documented an increase of 120% for missed care and 20% for task and queue time when describing the negative impact that an increased nurse-to-patient ratio has on quality control. This means that nurses are more likely to miss things, and it will take them longer to do their tasks whenever we have more patients. Congress has found that it is imperative to create adequate standards for staffing for registered nurses that provide direct patient care. This will guarantee quality care and patient safety, along with ensuring safe patient care to prevent injury or death due to an increased workload on nurses. This bill will prevent hospitals from using understaffing to save money for their financial bottom line. Currently, 49 of the 50 states do not have guidelines for appropriate staffing ratios. Without regulations, hospitals are allowed to staff based on their own policies and procedures that are often not aligned with safe care or nursing job satisfaction. Studies based on the changes seen in California after a recent bill was implemented to provide adequate nurse-to-patient ratios in 2004 showed an increase in nurse job satisfaction, quality care, patient safety, and increased nurse retention. By increasing nurse retention in hospitals, the hospitals in turn save money. It's very expensive to be orienting nurses frequently instead of retaining the ones that you already have. You also have a decrease in experience and education level whenever you're constantly bringing in new nurses that are unaware of the hospital's procedures. The recent introduction of HR 2581, Nurse Staffing Standards for Hospital Patient Safety and Quality Care Act of 2019, if passed, would amend the Public Health Service Act 42 USC 2019 by adding the title Minimum Direct Care Registered Nurse Staffing Requirement to put a nurse-to-patient ratio requirement into action for every state at a federal level. This bill is also supported by the National Nurses United and Nurses Take DC, as well as many sponsors and co-sponsors from the House of Representatives as of May 2019. Unfortunately, the bill is not supported by the American Nurses Association. The American Nurses Association does support safe patient-nurse ratios. They do not support the one-size-fits-all. HR 2581 was introduced on May 8, 2019 by the Illinois House Representative Janice D. Schakowsky from the Democratic Party. After being introduced on May 8, 2019, the bill was then referred to the Committee on Energy and Commerce and the Committee on Ways and Means to then be assessed by the Speaker to determine which jurisdiction of the committee it fell into. On May 9, 2019, the introduced bill was referred to the Subcommittee on Health. At this time, the bill is still sitting in the Subcommittee of Health. The bill is a reintroduction of the 2017 Nurse Staffing Standards for Hospital Patient Safety and Quality Care Act that was not approved. Unless the current 2019 bill is passed, only California will have regulations concerning nurse-to-patient ratios at this time. The need for this legislation was first noticed between the 1980s and 1990s. During the early 90s, nurses started to identify a shift in the nurse-to-patient ratio on their units as the hospitals strive to survive on less staff to prevent an increased financial burden on the facility. Doris Carroll specifically stated, "So very unsafe conditions, and that's what drove me to leave, because I felt I couldn't do what I had learned to do in nursing school and do it safely," said Carroll in 2015, after seeing hospitals become more about the bottom line financially than patient safety, Carol and her fellow colleagues launched Nurses Take DC, a nonprofit group that promotes safe nurse-to-patient staffing ratios. Due to the lack of support by the American Nursing Association, the split resulted in the California Nurses Association was formed in 1995. The creation of the California Nurses Association set the tone for the first state to pass nurse-to-patient ratio regulations in 1999, which was fully implemented by 2004. Due to the studies focused on the changes seen in California since that time, it is easy to see how the current legislation can benefit the nation if passed. On this slide, you can read about the appropriate ratios this bill hopes to implement. Currently, they are stating 1-to-1 for trauma emergency room situations, 1-to-1 for our operating room, 2 patients to 1 nurse for the ICU, 3 patients to 1 nurse for the emergency room, 4 patients to 1 for med-surg, and 5 patients to 1 nurse for rehab. In addition to this bill also includes whistleblower protection and appropriate use of technology. On this slide, we're going to talk about how this bill can benefit the public and the healthcare consumers. The decreased workload of nurses allows for more time per patient. This can be seen with education. Unfortunately, the first thing that is often taken away whenever we have more patients is our time for education. When we are not there to properly educate our patients, it can cause confusion in their care plan. It can also cause confusion in what they should be doing once discharged. Patients aren't educated properly, they can return to the hospital later because they did not perform the appropriate tasks at home because they did not get appropriate education. In addition to that, nurses will have less time to do their tasks with the patients. This could be seen with things like turning your patients to prevent pressure ulcers. If the nurse can't get back into her room at an appropriate time because she has 6 or 7 patients, she may not be turning the patient like they should be, and they can end up with skin breakdown. This is bad for the patient, and it is also bad for the hospital. With increased nurse-to-patients ratios, you can also see that not many nurses want to stick around. Because of that, the hospital may have to hire a large amount of temporary staff. Temporary staff also results in higher errors because these temporary nurses are not given the same orientation that full-time nurses are, and so they're not aware of the hospital policies and procedures, and errors increase, which can cause patient harm. Specifically, the highest affected population includes elderly, chronically ill, and psychologically unstable patients, as well as those undergoing lengthy or complex treatments are at a greater risk for experiencing various types of adverse events in care. That is from Clark, 2008. The Journal of the American Medical Association reported that for every patient over 4 that a nurse takes on, they increase the risk of burnout by 23% with a 15% decrease in job satisfaction. So overall, nurses are unhappy with their jobs, which can lead them to choose different career paths. In addition, a 2010 study found that when workers documented 3 to 4 hours of overtime per day, they had a 60% increase in cardiovascular disorder. So nurses are unhappy with their patient load, and it's also detrimental to their health, causing an increased use. On this slide, I have listed a couple of verses that I feel related to this issue. The Bible instructs us to give of ourselves to care for others. The purpose of nurse-to-patient ratios allows for nurses to have an appropriate amount of time so that each patient gets the right amount of care from the nurse and is never left wanting or in need of care because there isn't enough of the nurse to go around. When patient-nurse ratios are constantly increased, it is becoming ever more difficult to be a disciple of the Lord and show compassion and love for our patients. As the amount of work increases, the ability to connect with patients decreases because there's only so many minutes in a day. No nurse wishes to treat her patient as an assembly line and remove care and empathy from the equation, as the Lord would have us care for our patients as we are cared for by Him. After researching this legislation and coming to understand why the American Nurses Association does not support H.R. 2581, it became harder to see it in black and white. Mandated nurse-to-patient ratios will prevent hospitals from abusing their staff and causing burnout, which causes many experienced nurses to change their career paths. Personally, after working at a level 1 trauma emergency room and being shammed by coordinators when it was overwhelming to take up to 8 patients at a time, it is easy to see how this bill protects nurses. It decreases the amount of dangerous situations that nurses find themselves in that can ultimately lead to patient neglect because there isn't enough time in a shift to give everyone quality and safe care. Whistleblower protection is also important because it allows staff to say something when they feel an assignment is dangerous prior to accepting it without being reprimanded for not accepting it. Yes, the strict requirements of this bill could mean that there are longer wait times in emergency rooms due to lack of staffing. The counter is, how is an overwhelmed staff safe for those patients in the first place? Instead of healing patients, nurses find themselves in positions where they just hope to not cause harm due to the demanding and dangerous amounts of patients they sometimes find themselves responsible for all at once. Overall, this is a positive bill that could make a difference in the bottom line of patients and their nurses. The issue with this bill is that it is not flexible to the needs of different hospital facilities and emergency cases. Some hospitals could close due to the massive upfront monetary demands to increase the nursing staff. This bill also does not take into consideration the acuity of patients and experience levels of different nurses. If an emergency room nurse is mandated to a 1-to-3 ratio, what if the patients are all ICU holds? That's an overwhelming amount of patients based on the acuity level. Although this bill would say it's safe, the opposite of the 3 patients are stub toes. The nurse could easily take a 4th patient due to the lack of attention the other patients need based on patient acuity. The lack of attention to patient acuity in this bill is a fault that is impossible to overlook. Due to that, it appears it should be revised prior to being passed. In support of the American Nurses Association, it is recommended that a staffing ratio bill includes a committee approach allowing individual hospitals to provide safe staffing while also taking into account their available resources. The current HR 2581 bill does not require this committee. It only mentions that if a hospital committee is maintained, it should have 50% registered nurses on the board. This should be a requirement to prevent administrators from making decisions without the bedside perspective being directly involved. Also, instead of not including technology to substitute for patient care, the American Nurses Association considers how technology can be used in hospitals to take some responsibility off of nurses during their shift, such as cameras to monitor patients that need constant supervision. It is recommended that the bill takes into account the experience level of nurses working during a shift. For example, if the nurses are new graduates, they may meet the ratio requirements, but the experience and knowledge level available is still unsafe because of lack of experience on both of their parts. Hospitals do make a plea against this bill as well due to the large amount of costs associated with hiring more nurses to meet requirements and the likelihood of increasing salaries to retain nurses. While many large hospitals could absorb those costs while waiting for the saved money when less patient injuries occur, rural hospitals may go under due to lack of monetary funds for the upfront demands. In general, this bill is headed in the right direction, but could use some fine-tuning prior to being passed. That concludes my presentation on HR 2581. Thank you all for listening, and if you would like any further information, these are the resources that I used during this PowerPoint.